Hello, my name is Dr. Camille James. It is approximately 8:11 a.m. in the morning of June 16th, 2025, and today I will be conducting a case study involving Acarigidibacter actinomyces, which is an oral bacterial pathogen. This bacteria is known to cause chronic inflammatory gum infections, periodontal disease, and the proteins produced by this bacteria are known to trigger and contribute to rheumatoid arthritis in many people. Rheumatoid arthritis is the main focus of the study, but the Acarigidibacter actinomyces pathogen is equally important because it can assist in making a diagnosis for rheumatoid arthritis based on the fact that gum disease and rheumatoid arthritis usually occur simultaneously. Rheumatoid arthritis is partially an autoimmune disease that provokes inflammation in your joints. To this present day, it has yet to be determined as to what exactly causes rheumatoid arthritis, but many factors including trauma, sex, genetics, and infection with bacteria or viruses could possibly all contribute. This study is important because research revealed that about 18 million people worldwide have rheumatoid arthritis. My question is, if 18 million people have been confirmed, how many people are walking around with rheumatoid arthritis and don't even know it? Maybe this could bring a sense of awareness. My client name is Maria Gonzalez. She is a 55-year-old Hispanic female. She is 5'6" and weighs 220 pounds. She has a slight fever that's not too severe, displaying a temperature of 101. Her vital signs are good, with a blood pressure read of 159/99, indicating she may smoke cigarettes. When asked what brought her into my office, she replied that she was experiencing a significant amount of pain in her chest, back, and her hands. She said that her body often got tight and her joints became stiff and swollen. She said she found herself experiencing dry mouth and fatigue. After documenting her medical history, I discovered she was discharged from the emergency room 2 days ago for chest pains, so I am able to rule out heart problems associated with the tightness in her chest. But I did listen to her chest for any signs of inflammation. A careful oral examination was performed, which revealed swollen gums and a very white tongue, indicating dehydration. She confirmed my earlier suspicion of smoking and said that she smoked a pack of cigarettes a day. Because she mentioned joint pain and stiffness, I conducted a physical exam where I was able to examine her joints, how she bend, carries, lifts, etc. Her hands are visibly swollen with red rashes on her skin and bumps along her fingers. I ordered lab work so I could obtain a blood sample and an oral tissue sample. I also ordered image testing to get a better view of her lungs and chest. Before ending the session, I prescribed her with pain and inflammatory medication and assured her I would schedule her for a follow-up once I got her lab results back. Maria is displaying symptoms of rheumatoid arthritis, but before I could diagnose her with anything, there were a series of tests I needed to conduct first. Rheumatoid arthritis is hard to detect in its early stage because it develops over time. I ordered an x-ray to identify what could be the cause of her chest pain and swelling in her hands. I also ordered an MRI because it will give me a more in-depth view of her nerves and tissue. Let's say it is rheumatoid arthritis, for example. This test will not only help with a diagnosis, but will also reveal how bad the condition is. The blood sample I ordered is being used to conduct a rheumatoid factor test, which can help pinpoint and diagnose for rheumatoid arthritis, because she said she often experienced dry mouth and her gums are visibly swollen. I ordered an oral tissue sample to see if anything was contributing to her symptoms. During her physical exam, I was able to document the visibly swollen tissue in her hands, the rashes and bumps along her fingers, as well as her ability to bend, lift, and carry. As you can see, the x-rays of her hands, the swollen in her hands, and the x-ray of her mouth do indicate the bacteria, and the swollenness on her hands do indicate signs of rheumatoid arthritis, and the x-rays and MRI indicate that she does have rheumatoid arthritis. Based on the evaluation from the test results, I am diagnosing Maria with rheumatoid arthritis. To this present day, it has yet to be determined what exactly causes rheumatoid arthritis, but Maria is presenting many of the contributing factors, with the leading cause being the detection of the Acinetobacter actinomycetomatin pathogen identified from her oral tissue. This bacteria is a gram-negative oral bacterium associated with localized aggressive periodontitis. A thermocycler, also known as a PCR machine or DNA amplifier, is a lab device that amplifies DNA and RNA samples through a process called polymer chain reaction. It works by precisely changing the temperature of samples at specific intervals to amplify small amounts of genetics material. This was the process used to detect the Acinetobacter actinomycetomatin in Maria's tissue sample. Gum tissues and rheumatoid arthritis usually occur simultaneously. The x-rays taken on Maria reveals changes in her bones and joints, which is an indication of rheumatoid arthritis. Assisted with an MRI, I noticed how severe her condition was, which explains why her hands were so swollen and red. After examining her blood samples, Maria has a positive rheumatoid factor test, revealing she had a high level of rheumatoid factors in her blood. Such high levels are usually linked with autoimmune disorders, especially rheumatoid arthritis. Once I believe to be sure of the evaluation from the test results, I rescheduled Maria for a follow-up. I explained to her she had been diagnosed with rheumatoid arthritis. I engaged in client education to ensure she was aware of her condition, then proceeded to her treatment plan. I prescribed her methotrexate and sulfasalzine, which are both disease-modifying anti-rheumatic drugs. The purpose of these medications are to ease the symptoms of the condition and slow down its progression. DMARDs work by blocking the effects of the chemicals released when your immune system attacks your joints, which could otherwise cause further damage to nearby bones, tendons, ligaments, and cartilage. I also prescribed a short course of corticosteroid, which are steroids to relieve any pain. I educated Maria on the factors that could contribute to her symptoms, so she would be able to alter or reduce any future risk, meaning she was encouraged to stop smoking cigarettes and to consider a healthy diet plan to lose weight. To this day, there is no known cure for rheumatoid arthritis, but fortunately for Maria, the goal is towards achieving the lowest possible level of arthritis disease activity and remission if possible. This can minimize joint damage, enhance physical function, and quality of life. In conclusion, there was so much to learn from Maria's case study. For starters, it is good to know that gum disease and rheumatoid arthritis usually occur simultaneously, and although there is no known cure, it's good to know the cause and contributing factors that can trigger this autoimmune disease so that people can be sure to avoid them. The significance of this study and why it's important to the medical field is rheumatoid arthritis not only affects the joints, but it can also affect internal organs, which can cause permanent disabilities in some people. Research reveals that 18 million people worldwide have been diagnosed with rheumatoid arthritis. The question is, if 18 million people have been confirmed, how many people are living everyday lives and don't even know they have rheumatoid arthritis? Although this study did not produce a cure, hopefully it can assist with keeping this disorder at its lowest level or possibly in remission. Thank you.